For platelet aggregation inhibitors, the role of the pharmacist can be many things. Number one, of course, just making sure that they're on dual antiplatelet therapy to begin with. But I think identifying the patients, for instance, who's going to surgery and knowing when those agents need to be discontinued prior to surgery, and should there be conversations going on with the providers about if we need to stop a dual antiplatelet therapy regimen, such as needing to stop something like clopidogrel or ticagrelor prior to surgery, does something else need to be done in the meantime, depending on how recent their stent placement is. Obviously, counseling patients on the risks of discontinuing on their own dual antiplatelet therapy. I think it's very important to be talking to your patients about whether they should be having a conversation with their cardiologist about how long they need to remain on them or what to do if they need to stop them. The cardiologist always needs to be involved in that. And then doing the counseling points to the patients on what to look for, what are my risks of bleeding? So talking to the patients about the bleeding risks, what do those look like? And so that the patient can be well informed and have conversations with the doctors if they do run into side effect trouble.